Hi guys, welcome to my vlog for Fresh Toast, bringing you the freshest news straight out the toaster. Today we will be discussing Vega's healthcare. Many universities, such as WITS, have a healthcare centre. DUT has an established pre-hospital life support and rescue service on campus. The sad truth is, if we had a heart attack from alcohol or a car accident, we'd most likely die due to a slow response. And that is not even the worst. How many shootings have been happening at universities at the moment? 1 park, 2 park, 3 park, no. We need to be mentally stable as students. And Vega definitely makes everyone a little bit loopy. How long until that quiet guy brings his gun to school and starts shooting everyone because no one understands it? Pat, Jeanette, pat. I'm not saying we need the whole cast of Greys running around here making people sad. No, that's not what we need. Just one medically trained staff member, a website or a handbook with medical tips, a sick bay with basic medical attention, and some standard procedures that will happen in the case of a medical emergency. I've conducted an interview with a student for Vega who's had problems with the medical attention. The student wants to remain anonymous.
The one day I stepped on a thorn, went through my shoe into my foot, and I was in a lot of pain. So one of my friends went to go call the medical ladies. She was in the library, which is the second floor of the building. She strolled down the stairs. I had to wait, and Joel said, she didn't know what to do, so Joel said that she must go fetch one of the guys on the second floor, but she didn't. She went to the first floor to go fetch Brenda. She didn't know what to do either. So then one of my friends went to go fetch the other guy on the second floor because the medical lady, who's supposed to know stuff, didn't know what to do, and she didn't want to walk up those stairs. So I had to wait. And eventually my friends drove me out of Vega because I couldn't get any help at Vega. So yes, I got help outside of Vega, and the Vega people didn't really help me, and they didn't know what to do at all, and I was in a lot of pain. The thorn was in my foot for at least about 10 minutes. Yes.
Although this occurrence was upsetting, it was not life-threatening. If it was, do you think there would have been a faster reaction? Probably not.
Mental health issues in a broad sense certainly remain a primary issue. Stress is the big one. We should have a centre that offers to help students dealing with stress and anxiety, and probably have places like yoga, acupuncture, meditation. We should also have talks about sleep deprivation. Infectious disease. We should be having regular checkups to ensure the diseases are being noticed and treated. There's no particular bug on the radar this year, but exposure to diseases such as influenza, colds, or respiratory diseases. Vaccines can help against some of the usual suspects. The Centers for Disease Control and Prevention recommend that vaccines take place on campus. Exercise. Weight problems are everywhere, even in college campuses. Some may call it first-year spread, but sometimes it lasts longer. What does the CDC recommend? Lots and lots of exercise. Adults should be active at least 2 to 2.5 times per week. Some students, however, may not be getting enough. Too many college students are not heeding the advice and warns that despite what they may think, some students are not going to be immune to the obesity epidemic. We should notify our students, teach them the importance of exercise and the effects it has on their body and their mental health, and tell them how to get into it and how to sustain it for their own personal health. Alcohol. Discussion about college health would not be complete without talking about alcohol. If students were to make the decision to drink in college, which we're pretty sure they do, we need to teach them about the choices they make on what to drink, how much of it to drink, not to mix those drinks, and also the things they need to do in order to remain safe, responsible, and still have fun.